at year 2015 in the Ministry of Health. What do you think about these expenditures? Chemotherapy, hormonal therapy, one of the products representing 21% of the expenditures of this product. So if we have a country, have a policy, an effective policy, how to use an efficient use of our resources by using maybe a biosimilar, maybe one of the clues, one of the elements for reducing the economic impact and the economic burden of cancer, it will be efficient for us to use a product after guaranteeing all the issue needed for guaranteeing this product. Okay, and this is also the distribution for cancer in government rates. So, what is the missing piece? We make a lot of presentations, a lot of conferences, a lot of plans. What is the missing piece? I think the missing piece, we need to know what is the real definition of health policy. We are all here in this day, we are all regulators. We are all policymakers. We are one of the majority of stakeholders for the process for biologicals in Egypt. But because we need to know the real definition of biotech policy. Health policies are public policies or authoritative decisions that pertain to health or influence services. Health policies affect or influence groups or class of individuals or organizations. From forms of health policies. We have a lot of forms of health policies. One of them, there are 5 main forms of health policies. One of them is laws. The second is rules and regulations, operational decisions, geographical decisions, macro policies, and I will emphasize about regulation. Why regulation? Because we are all regulators. So, why regulators? Why regulate? All substances are poison. There is none which is not a poison. The right dose differentiate a poison and a remedy. Medicine, this definition is from 1493. It's an old definition. Why we regulate? To ensure quality, safety, and efficacy of products in order to assure the continual protection of public health. No drugs product is completely safe or fictitious or circumstances, but there is a moral as with a legal expectations that appropriate are taken to assure optimal quality, safety, and efficacy by the producers concerning benefit versus risk. I want to emphasize about the last word is benefit versus risk. There is no 100% safe product, but it should be 100% efficient efficacy system guaranteeing policy. Why we need regulations? Drug development and commercialization is highly regulated. The path to drug registration, marketing, authorization is paved with good intention, but can be complicated. Things change continuously. What do you think? Mind the gaps. What do you think? When I asked you in the first minute of my presentation about the gaps, you saw that there is no gaps. Let you this a gap. One of the gaps is knowledge gap. There is a big difference between the knowledge of regulators and the knowledge of the stockholders. There is a big difference between regulators and stockholders. Regulators are part from the stockholders. If there is a gap between knowledge transfer from the regulators to the stakeholders, it will make a problem. In your opinion, what is the main stakeholders for biosimilar concept and cancer concept in Egypt? I think there is the purchaser, people who buy the product, also the prescribers, oncologists who prescribe the product. Does anyone